Today, I'm going to talk about Smile Direct Club and the most important things you need to know before getting aligners. So we're going to break this video down into three main topics. First, we're going to talk about Smile Direct Club. Next, we'll talk about some of the important things you need to know before starting your braces journey. And finally, I'll talk about what I think the future of braces looks like. And before I get started, I just want to mention that I'm not for or against Candid, Smile Direct Club, Byte, or any other braces related company. I just want to make sure that patients are as informed as possible before doing anything that involves their teeth and their smile. And having an open, honest conversation is the only way to do this. So what is Smile Direct Club? Smile Direct Club is a company dedicated to helping you straighten your teeth at home at a rate that's more affordable than going to your local orthodontist. In fact, their rates are listed at $2,000 or $89 a month, which is actually way more affordable than going to an orthodontist that may charge you anywhere between $5,000 to $7,000 for your treatment. So how does it work? Well, according to the website, it's actually quite simple. First, you need to take an impression of your teeth digitally at one of their smile shops, or you have the option of doing it by yourself at home with one of their at-home kits. And I'll talk about some problems I see with the at-home kit later on in the video, so stay tuned for that. Next, the company receives the impression either digitally or manually. They create a 3D image of your teeth, and then a state licensed dentist will review and approve your treatment plan. Finally, they create a set of aligners that is custom fit for you. They ship out those trays to you, and then over the course of the next couple months, ideally you will have a straighter and more beautiful smile. Now, according to the website, the company offers two main options. Clear aligners are meant to be worn as often as possible, and they also came out with a new one called nighttime clear aligners, which is meant to be worn at night so that you can be aligner free during the day, which is another thing that I'm not really sure about, but I'll mention that towards the end. So let's start with this. What are the differences between aligners at an orthodontist versus Smile Direct Club? Well, the aligners themselves are actually quite similar in material, but the main difference is the addition of buttons in your treatment plan. Buttons are bonded resin that are attached to your teeth during your Invisalign treatment at an orthodontist office. These buttons allow orthodontists to achieve a greater degree of movement for teeth that need a little extra push or torque or rotation to get into alignment. As of the recording of this video, Smile Direct Club does not offer buttons, and they mention that their service is only meant to correct mild to moderate teeth corrections. This makes sense because it would be really hard to move teeth in a big way if you don't have these buttons available to you. Meaning that if you have severe crowding or rotated teeth or an open bite or major issues going on, then the orthodontist is probably going to be the best way to go. I have a very close personal friend who also does YouTube and is also an orthodontist named Dr. Greg, who created a Facebook group called the Braces Club where people share their cases. So if you're looking to get more of an idea of what type of cases are out there, I would definitely encourage you to check out that group. I'll put the link in the description below. Okay, so now that you have a little bit of a background, what are the most important factors you need to consider before starting aligner therapy with an orthodontist or at Smile Direct Club? Well, the most important thing to do is to make sure your gums and teeth are healthy. And the way you do this is by visiting your dentist and getting an examination done. First, we need to make sure that you don't have any cavities, and if you do have any cavities, the dentist will fix you up by either putting a filling or a crown or whatever work you need to get done, they will do. Now, before you start to move your teeth, it's really important that you don't have any periodontal disease. There is a lot of bone that surrounds your teeth, and if that bone is compromised in any way, if you're moving your teeth with aligner therapy or with braces, it can be really detrimental. There are some cases out there where people lose their teeth after getting braces done because they didn't have a proper examination done before getting started. We also want to evaluate the roots of the teeth to make sure they're not too short, because when you're moving teeth and you're applying forces to teeth, sometimes you can have a root resorption at the end of the treatment, which can make your teeth even shorter and cause mobility issues. So the main thing you need to know is to get checked out. Please, I implore implore you, this is a really important step before starting your braces journey. I should also mention that most dentists like to take individual x-rays when they're doing a comprehensive examination, but your local orthodontist might take a panoramic image, which is a different type of image that helps you visualize your teeth in a different way that allows them to coordinate a really accurate treatment plan. The second most important factor is a really accurate impression. You have to imagine that aligners are made in a series. So if you don't have a really accurate impression, and that impression is distorted or off by just a little bit, then each subsequent tray is going to be a little bit off, and then the final result may not be what you want. Orthodontists, they have a trained team that knows how to take an impression either manually or digitally, and then the orthodontist will review the impression to make sure that it's accurate. Now at Smile Direct Club, they offer two options. One where you go to the Smile Shop where you work with a trained team of impression takers, and the other option is the option where you do it at home. But what I personally have issue with is the taking of the impression of yourself at home. Now, Smile Direct Club gives you an impression kit and they tell you step by step how to take that impression, but I personally feel like it won't be as accurate as possible. Now, according to the website, they do say that when you send the impression back to their company, they have a dentist or orthodontist that reviews the impression to make sure that it's accurate. But just knowing how difficult impressions are to take, especially on my own patients, I have a little bit of reluctancy to believe that people can take their own impression and get it really accurate. And the reason I'm concerned is because, like I said, it needs to be accurate so that when you're done with your aligner therapy, it looks the way that we planned it to look. So that's just a concern of mine. If there's anyone out there that does use Smile Direct Club and they've done this process, please let me know some more information so that we can understand the process a little bit better. Number 3, wearing your tray consistently. When you're undergoing aligner therapy, the most important thing to do is to wear your trays as often as possible. And typically what we tell our patients is to wear it, 22 hours out of the day, meaning you only take it out to eat, to brush your teeth, and that's it. And that's so important because if you take your trays out, your teeth have the ability to relapse into its original position, or they might move a little bit. So when you're wearing trays, you want to wear them as often as possible. Now, this isn't the case if you have traditional braces, when the brackets are on your teeth and you have a wire in your mouth because they're on there. You don't take it on and off. Now, at the orthodontist and at Smile Direct Club, they both have these instructions about wearing your trays constantly. But Smile Direct Club offers nighttime clear aligners, where you just wear a variety of trays only at night and you don't have to wear them in the morning. I personally would be a little bit reluctant to try that because if you're only wearing them at night and then you take them out during the day, there's gonna be some shifting going on because you don't have those aligners to hold your teeth in the natural arch. So I don't know a lot about the nighttime clear aligners, and once again, if anyone currently has nighttime clear aligners, please let us know what the process is because I'm basing my information off of their website. And the last important thing is a continuous monitoring of your teeth. When you get your aligners in, you're going to be switching them periodically every couple weeks. And every time you get a new aligner, it's going to be doing a slightly different shift that gets your teeth closer to the ideal arch form. But sometimes those movements don't work for whatever reason. Maybe your teeth are anchored into your bone and they don't want to rotate a certain way. And if you don't monitor the case, then you could be on your 5th set of aligners and one tooth wasn't moving from your first set of aligners, and now everything is kind of shifting in a way that it's not supposed to be shifting. So it's really important to have someone monitoring your case to make sure everything's going smoothly. And if it doesn't go smoothly, then you take another impression of the top and bottom teeth and you create a new set of aligners or a new treatment plan to get you back to that ideal form that you want to accomplish. So I think it's really important that someone is constantly monitoring your case so that you don't finish your entire set of aligners and then you look at your teeth and you say, oh, why don't I have the perfect smile? This isn't exactly what we planned for. And you'll get frustrated. Now, I believe Smile Direct Club offers some type of support for these type of issues. I'm gonna do some research and look into that. And I know the orthodontist definitely offers that type of support because you can always call them, or they have these periodic checks where you go in to make sure your teeth are being aligned in the right way. All right, so what's the future of braces? Well, I see a lot of companies like Byte, Smile Direct Club, and Candid offering an affordable solution to braces, an alternative to going to your local orthodontist. I believe that as we move closer to the future, there's going to be some sort of marriage between going to your traditional orthodontist and getting your braces done at home. And it'll be interesting to see how these companies adapt and resolve any of these issues moving forward. Personally, if I want my teeth moved, I'm gonna go to my local orthodontist to do the examination and to do the treatment. But I do also understand that braces can be expensive, and these companies offer a more affordable version that is offered, directly to you. Tell me what you guys think. Where do you see the future of braces? What do you think about these companies? Let's talk about it. Anyways, thank you so much for watching this video. It was a pleasure for me to make, and I'll be making more in the future. If you have any questions or comments, let me know. If you want me to make any other videos in the future, leave it down in the comment section, and I'll see you for the next one. Thank you.